Joining me tonight here in studio in New York, Senator Bernie Sanders of Vermont. Senator, good to have you with us tonight.
Good to be there.
These numbers over the weekend, what does it tell you? The number of people that signed up round two.
It tells us that you have a program that is working well, that they have overcome the problems that they initially have. It tells me that about 75% of the people who are on the exchanges think the health care that they're getting is good. And I think this is making our Republican colleagues very nervous.
What could they repeal as you see it?
Nothing, because Obama will veto it, and we will sustain that veto.
Okay. Now, a recent poll, as you mentioned just a moment ago, Gallup poll says that 7 in 10 people who purchased insurance through the government exchanges this year rate their coverage as excellent or good. But the overall approval rating for the Affordable Care Act sits at 37%. Where's the disconnect?
Well, it is not everybody is in the Affordable Care Act, and people who have maintained their old policies are hearing negative things about it over and over again, and I think they're responding to that negativity.
So you think the media coverage has had a lot to do with it?
Absolutely. But I think what we should understand, Ed, is Republicans want to destroy the Affordable Care Act, which is, by the way, a modest proposal, you will recall, developed by Republican think tanks, implemented in Massachusetts by Romney. They want to destroy it not because of what it is, but because it is the federal government doing something to protect ordinary people. And that is not what they like. These are the same guys who want to end Medicare as we know it, convert it into a voucher program, make massive cuts in Medicaid, in other federal health care programs. Ultimately, at the end of the day, what they want is all Americans to go into the private sector exclusively for their health care. And if you don't have any money and you can't afford it, tough luck.
So you think that they're so ideologically driven that there's no statistic out there that would make them step back and say, you know, maybe this isn't so bad after all?
No. You have something like Social Security, which is enormously popular. You'll recall what Bush tried to do to Social Security. These guys do not believe the federal government should play a significant role in protecting the lives of ordinary people. And it's not even just health care programs. It is environmental protection programs. That is the right-wing ideology. Meanwhile, we remain the only major country on earth that does not guarantee health care to all people as a right. We end up spending almost twice as much per person on health care as do the people of any other nation.
So why do they want to continually harp on the fact that they want to repeal it? It's all ideology, or do you think they have a better plan down the road?
No. Better plan? You tell me the better plan. What have you heard about their better plan? They have no better plan. They have no plan. They have no better plan for Social Security. What these guys want to do is to tell the American people, hey, you think government could do something for you? It can't. Only the private sector can do things for you. And you don't even have to come out and vote because government is irrelevant to your lives. That's what this whole thing is about ideologically, Ed.
What's your reaction to the profits that have been sustained by the major insurance companies since the Affordable Care Act? WellPoint at 37% was the highest one, but most of them between 18 and 37% return on investment. I mean, it doesn't seem like it's changed the insurance industry too much.
It hasn't. We are, not only are we the only country on earth that doesn't guarantee health care to all people, we are the only major country on earth that allows private insurance company to make huge profits off of health care. Look, at the end of the day, I voted for the ACA. I support it. But I believe we've got to do what other countries are doing. Guarantee health care to all people. Move toward a Medicare for all single-payer program. Get the private insurance out of the health care business.
How do you read what the Supreme Court is about to pick up? That the federal subsidies are a problem, that low-income people would not be able to constitutionally take subsidies. What about that? And how do you think they'll rule it?
I don't know how they'll rule it. But, you know, they've already caused massive problems by giving Republican governors the ability to opt out of the Medicaid expansion program. Look, Obama was talking about 9 or 10 million more people now having health insurance. That's a step forward. There would be a lot more people if the Republican governors did what we wanted them to do and what we expected would happen, expanding Medicaid.
And Senator, your thoughts on the right wing that says that, well, you know, millions of people have lost their policies too. The Affordable Care Act, correct me if I'm wrong, has standards that the industry must meet. In other words, for lack of a better term, junk insurance. Junk insurance might not be, to me, what it is to you or vice versa. But the fact is, we have industry standards now.
Right.
That's really the framework of the law, isn't it?
Yes. The mistake that Obama made is saying, look, if you want to keep it, you can keep it. The truth is, what the ACA did is get rid of these junk policies, which meant that people thought they had some coverage until they got sick, and they understood that they had sky-high out-of-pocket expenses, deductibles, and co-payments. So there were minimal standards set, and those policies were done away with. So, yes, people lost their junk health insurance policies.
Senator Bernie Sanders, good to have you with us tonight. Thanks so much, Senator. Appreciate it.